Hi, I'm Carissa. I'm representing Group 22 to present to you our topic, which is Autism Spectrum Disorder, or also known as ASD. Before I go in depth, how well do you know about autism? Some may have a little idea about autism and some may not. For those who have unclear picture about ASD are quite normal because person with ASD does not expose much into society. Only family with ASD family members are highly alert about this disorder. In this video, I will explain about the autism itself, autism diagnosis, and their common behavior, the factor that cause this disorder and therapy, and at the end of this video, I will explain about the relation of autism with brands and sex. So, what is autism spectrum disorder? It is a neurodevelopment disorder which can cause social communication impairment and commonly as the person will have a repetitive behavior. As I mentioned earlier, back then society are not aware about this disorder, but recently, in the past few years, many autism organizations or associations started to organize many campaigns about autism with their main objective is to give knowledge about ASD. Why this association or organizations are being so proactive about this disorder? It is because the ASD population is on the rise, in which 1 out of 59 children at the age of 8 were diagnosed with ASD. Before the American Psychiatric Association revised the manual to the 5th edition, which is the Diagnosis and Statistical Manual of Mental Disorder 5, disorders such as pervasive disorder, autistic disorder, and Asperger syndrome were an individual disorder. But after they had revised to the 5th edition, all of those disorders are grouped into ASD, which is the Autism Syndrome Disorder. So, how can we see someone is having an ASD? Commonly, they will portray expressions such as anxiety and depression. For example, if they are not familiar with the environment or the daily life does not fit to their usual environment, they will feel depressed or develop anxiety. This is due to their frustration because they cannot react to the new norm. Yes, unlike a normal person, autistics love monotonous activities. That is why, if an autistic is in a place that he or she does not familiar with, they tend to have anxiety or having breakdown. Furthermore, as they having a hard time to mix around and communicate with people besides lacking the emotion control, they usually will express the emotion or their needs through behavior. Not that not all the behavior shows that a person having ASD. We cannot judge a person as autistic when meeting with a person with a poor social skill. Maybe he or she have a slow speech disorder. And also remember, not every autistic portrays the same behavior. Of course, not everything in the world is perfect. Naturally mutated gene will always be the main factor of this disorder, which the chances of the next child is an autistic is higher in the family members having a history of autism. In here, there are 100 high confidence genes that are associated with ASD, and these genes are a rare variant. Why it is rare? Because this gene replicates independently, which this replication only happens in 5 to 10% of the autistic population. Secondly, a person to develop this disorder does not because the nature itself, but may due to the environment that they live in. This is why some people are live like a normal person when they are in young age and they start to develop this ASD when they get older. For example, this is a discordant twins whereby only one of them is an autistic. This happened because of the epigenetic process that occurring in the DNA alterations. As a result, the genes are tailored as a gene transcription replacer. Moving on to the therapy. A therapy does not work as a cure, but to only helps, I emphasize, but to only helps autistic to perform better. Again, I would like to clarify that every autistic shows variant behavior and diagnosis. Therefore, the therapy needed are different. The first therapy is using the behavior and communication approaches comprises of applied behavior analysis, which is to motivate positive behavior and change the negative behavior. Discrete trial training, which is to get a desired behavior, which desired behavior will be rewarded while the vice will be ignored. And the pivotal response training along with the verbal behavior intervention is to enhance motivation in an autistic to learn from the surrounding. Still in the behavior and communication approach, another examples are speech therapy, which is to improve communication skills and to prepare along to teach verbal communication skills in autistic. The DIR therapy is a flow time approach, emotional relation development that dealing with senses, and the TEAACH therapy is a visual cues to teach life-basis motor skills. Lastly is the therapeutic essential oil, which sometimes came in handy because it can relieve and stabilize autistic emotion. These oils give a soothing sense, which then stimulate the brain to become more calm. Adam, as shown in the picture, is an autistic. His father is a founder of the Terra essential oil, and his family use this oil to calm him down, especially during his breakdown. Proceeding to our last focus of the topic, which is the relation of autism with brains and sexes. Researchers prove that the brain of an autism is much more larger than a normal person's brain, especially in the expansion of cortical surface area. An experiment was conducted on a group of autistic that shows the expansion of the volume of white and gray matter. As the brain grows larger, therefore, result in a higher neuron density. The top diagram shows the different density of neurons. The top neuron is a normal development neurons, while below is a development of neurons in an autistic. While in the second diagram shows the volume of cortical of a typical development and autistic brain. Can you see that the brain volume is much more larger than the other? Moving on, I will explain the size of brain of an autistic, then relate it with the possibilities of which gender having the higher chances to be an autistic. An embedded figure test was conducted among a group of autistic and normal people with a different gender. The result of this experiment showed that the typical male brain development having the closest value of detection speed to the autistic. In addition, this test portrays autistic detect the image more precisely than the typical gender. The closest typical brain in different gender shows that male will have the higher chances to develop SD. Next, emotional intelligence test. Even without knowing the result of this test, we can make a simple assumption that female will score a higher test or higher value in this test due to our perception of women are associated with emotions. This test questions about empathy and the activations of the inferior frontal gyrus is larger compared to male and autistic. Again, the result closest to autistic is male, and therefore male having a higher chances to be an autistic. Also, systemic quotient test shows the typical males having a higher interest in systems such as complete a mess. But autistic score much more higher compared to the other typical gender. Not that all of us having an autistic trait, but it depends on the gene activation and factors of gender to show the behavior of an autistic. Both social and non-social stimuli is applied on both gender and an autistic. It can be observed that the male took more time to stare at a non-social stimuli. Researchers also found that autistic also having a longer time looking at a non-social stimuli, while female took longer time looking at a social stimuli. Next is the testosterone hormone, which this hormone actually masculines the brain, thus has an organized or programming effect. The autistic trait at the age of 4 is greater when the testosterone level is greater during prenatal stage. At the age of 8, these children will have difficulties in reading facial expression when this testosterone hormone is higher. They score better, but this hormone makes them score better in embedded figure detection tests, which detect accurately and faster in finding target shapes. The superior temporal sulcus and right temporal junction positively correlated with perinatal testosterone. This was proven on an animal testing showing that the level of testosterone influenced the development of the brain. During the prenatal stage, the possibility for the mother who generates her own hormone can be crossed over the placenta and the child itself. A China studies that a mother with later diagnosis autistic children having a higher level of testosterone in their mother. This is confirmed when a mother with polycystic ovary syndrome caused by excess testosterone affecting the menstrual cycle regularly will have a higher chances to have a child with autism.